And with this, we'll quickly move on to our next panel discussion. We're talking about new age healthcare models paving way for new India. I would like to invite on stage the panel now, Mr. Pranav Saxena, Chief Technology and Product Officer of Flipkart HealthPlus, joining us for this conversation. I'll request you all to kindly welcome the gentleman with a round of applause. Joining Mr. Saxena is Ms. Khushboo Aggarwal, founder Zyla Health. Welcome, sir. Mr. Senu Sam, CEO and founder MyKare Health, is also joining us for this panel discussion. To moderate this session, we have Dr. Purav Gandhi, founder Healthark Insights, to make this conversation a fabulous one. Thank you to the 5 people who tried to applaud there. For the rest of you all, one more time for the whole panel, if I can request you to join in welcoming the panel. Thank you.
All right. Good afternoon, everyone. Sorry to be standing between you and lunch. If not short, we'll try to at least make it informative and interesting. The topic today, new age delivery models or healthcare delivery models, is a very interesting one, mainly because there is no set definition of new age healthcare delivery models. There are various ways to define it. Someone can talk about these models being more patient-centric. Someone can talk about these being more quality-centric. These could be more accessible, more affordable. These could be very scalable. So there are various ways to look at new age business models. But at the heart of all these, one common theme always stands, which is digital. Digital is a way for making all these business models happen. Now, when we look at digital health, there are many strides that we as a country have made. A lot of innovators have made in recent years. It's very easy to complain that healthcare quality is bad. The standards are not comparable to other industries. It's very easy. But if you look at the transformation that has happened, it is ubiquitous. A lot of things just happen in the background where we don't even notice. Nowadays, going for a teleconsultation, buying insurance online, buying medicines online, this has become second nature. We can't imagine a life without it, right? And today, what I want through our panel is to touch upon how these innovations have come to life. What is the benchmark they set for themselves when it comes to new age business models? And in the panel, we have everyone coming from a very different subsector in healthcare. Senu works in surgical tech. Khushboo works in mainly chronic care, and then Pranav works on the e-commerce side with e-pharmacy business of Flipkart Health. So maybe we'll start with Khushboo, the first question for you. If you can, for the audience, define what is your definition of new age business models when it comes to Zyla, and how have you been shaping it? What are the challenges you have seen in terms of trying to become new age, because the benchmark keeps shifting and you have to always keep up with it?
Right. Thank you so much, Dr. Purav, and very excited to meet all of you here today. I'm Khushboo. I'm the founder here at Zyla Health. So I would say, Purav, the way the model definition is evolving in our country, until 2010, we were very focused on physical infrastructure being set up to provide care through hospitals, pharmacy, diagnostic labs. Fast forward a decade, up to 2020, we have evolved to something called e-commerce, online transactions for healthcare, right? Something that Flipkart is leading and many other providers are leading. Fast forward another decade, starting 2020, we have seen the focus shift from e-commerce to now care delivery led, right? And just to explain to you what that means, healthcare was supposed to improve health of people, right? That is the main focus or agenda of healthcare. Until the last many decades, we've focused mainly on selling healthcare products and goods, getting people under, the treatment loop, selling them surgical care, selling them, devices, selling them diagnostic tests, medicines, and so on. But the actual purpose of healthcare was to improve the health of people. So by care delivery-led models, I mean, the model you see in the US, for example, with Kaiser Permanente. It's called an IDN network, Integrated Delivery Network, which means that the payer of insurance, the payer of health insurance, indemnity insurance, actually starts also accounting for people's healthcare outcomes, starts putting them on a wellness journey. Because if you see, in the entire healthcare ecosystem, with so many players from pharma to diagnostic to hospitals and so on, the one player whose incentive is truly, truly aligned towards better health outcomes, which was the purpose of healthcare, is the insurer. So in the new age healthcare model, we see insurers taking that leap. We see that insurers will create ways to deliver healthcare management because they truly have the right data on the user. They know who's at risk, not at risk, and provide that care. So at Zyla, we have evolved our distribution, our patient reach out in a way that we partner with large payers, large health insurance payers who are ready to spend certain money to improve the health of these people. Now, when we say how is the health improving, there are two things to look at, right? One is, what is a product? What is the patient touching and feeling? So it requires a very intensive look at how you are codifying the patient data, how you're intervening on their health, how you're staying in touch with the patient, right? Because a symptom can happen at 12 a.m. or 1 a.m., right? A health issue, a new report can arrive at 6 a.m. So it cannot be ad hoc, or it cannot be very, very broken experience. So you have to create 24/7 management systems to stay in touch with the patients, get the new data, intervene in a highly personalized way. That's a solution we believe, that we've developed, and we believe, globally, a company like Optum or Omada, or in the UK, Oviva is pursuing, because that's a true way of taking care of patients. And the second bit, really important in this integrated delivery network, which brings the insurer and the provider together, is how you digitally exchange data, how the system is interoperable. So how you codify data in languages such as ICD-10, which is globally understood from day one, so that the data is neat and exchanged, and you can provide personalized care, becomes very, very critical. So my bet is on the integrated delivery network, or the care delivery-led model that we are pushing for in India as well now. And just last bit, you may think, why now? Why is this happening today, and why didn't it happen yesterday? It is a function of two things. One is your insurance penetration in a country. In India now we've hit a 35% plus, given the push by IAMAI and Ayushman Bharat pushing insurance through. Second is awareness. Thanks to COVID, we fast forwarded almost a decade in India with respect to awareness for healthcare and insurance. So these two parameters have sort of played a role since 2020, and the model is now hence evolving to the integrated delivery model.
Thank you, Khushboo. Thank you for the definition and at least setting the tone for this discussion. Next one, I want to come to you, Senu. Surgery, right? Traditionally, as I studied medicine, or for anybody, is such a hands-on topic. It's almost hard to intuitively imagine the role of digital health in surgery. And yet here we are, you and various others are leading the way for surgical tech. So maybe if you can talk about how you are building new age business models in surgery using digital health, and also how do you do the right balance between digital and physical to ensure that the experience is right for patients?
So first of all, thank you for this amazing panel and amazing audience. A lot of faces is familiar to me because they are very, very seniors. I respect a lot of people who are sitting here. I've been in healthcare for last 13 years. Started my career with Apollo Hospitals, and been to Clinicus Global Hospitals, MGM as a vice president. And I started my own one fertility center in Hyderabad. And after that, I was looking to do something scalable and to make sure the patient experience has been taken care. I started not knowing what is new age or what is digital health can really. I started my company because of my personal experience in healthcare. I worked all in the branded facility, but when my father was undergoing a surgery, it was a COVID period, I had to fly back to where my house is, which is a tier 2, tier 3 city. And being there, I can't take my father to the branded facilities, which I have been experienced in because of the travel restriction. Because 13 years I've moved out from that village, when I want to know basic things about who is the doctor I have to consult with, and what is the experience of that doctor, how many surgeries that doctor has been done, and which hospital I have to take my father. Majority of this information, even it's not available in the digital forum itself, because it's a basic, as I look, in the new age young generation, will be having a definite 360-degree of search to look for a healthcare where they have to take their parents. So I was doing the same thing. So I thought the challenges end there. Finally, I reached out to one facility somehow. And the moment I reached there, the day 1 to day 5, I to post running around to clear my insurance process. I never knew that it is that challenging because I was totally 13 years, been only in a different world of healthcare system. And seeing that, okay, it's not only my father, there are hundreds of patients which is waiting there, is also going, and they think this is normal. And because I can't accept it, because I seen this is not normal. And somehow I got 10 to 15 minutes with my doctor, and he told the surgery is required. And whatever I'm asking, I'm not told my background to the doctor. Even my father-in-law and mother-in-law are doctors. So I'm not told or used any of that influence, but doctor told, just trust me, come for surgery. We have to take the surgery thing. And the cost when I'm asking is telling like 1 lakh to 5 lakhs in between. 1 lakh to 5 lakhs, there are a lot of figures are available. Which figure I have to choose? Because if the insurance cover is coming to a copay, what is the money I have to be kept on? And somehow we admitted the father there. The discharge happened. The copay, so many clauses, I will start learning about the insurance only on that day. Okay, this many things I had to learn before taking an insurance policy. And there is an extra payment I had to give to the hospital. Finally, my father discharged and gone back to the house. I came back where I was doing my work. And every day my father used to call me. Can I sit? Can I walk? Can I? So I told, why you are not calling back that hospital? Why are you not talking to the doctor? So like, I don't want to go to that enormous pain of process. So this is the one way I have to tell what I'm solving. The surgery might be the last bit, but the patient, I think this is an industry where the customers are coming with lot of anxiety, pain, and over in that, the process and the systems, I think the care is missing in the healthcare for the missing middle class income people of India. And that care, I can't accept because the middle class people should get that care. And that's what I experienced and I seen, and I was communicating and advocating for the millions of people when I was in a bigger platform. But when I'm seeing my parents, I can't accept. So when I seen that, I thought, okay, let me, even if it is a small thing, I want to solve it. The experience of the customers. So in a simple word, we are not in how many surgeries we are doing. Instead, we are looking for, even if one surgery we do, that customer experience should be 7-star. He should make sure that the moment it is touched on our platform, to back to house, he should have a seamless and he should have an amazing experience which a common man cannot even expect. So look, small things. The pickup is there, the insurance process is taken care, the counseling is being done. All might be one bit, but as a consumer, when it is looking, it is like one of the data which I have seen is that the fear of surgery. Like in US, if 100 people has been told surgery, 60 people are being doing surgery. In India, it is less than around 15%. Rest of the people, like I have an ACL. While I'm talking, I have an ACL. But I am pushing it because I think, okay, I can do it tomorrow. I have to do this work. I have to build my company. I can do it day after. And there is a fear in me. And just because of fear, people are pushing this, and it can be another pandemic tomorrow because all the surgeries are being pushed. People are just waiting. Someday, because this experience, people are not, there is MyKare is available. This experience can be taken care. They can offload their things. So in between, I have told one thing, that healthcare, if you're going for a tour or a travel, you are already in a pleasant moment. Making that customer slightly more better and happier is easier. But in healthcare, they're coming with a lot of anxiety, fear of surgery, tensions, don't know the process. In between, our healthcare system itself is having enough of silos of process challenges. So my role or our company role or all the new age digital surgery tech companies' role is to make sure that customers is being taken care seamlessly and their experience has to be better, and we can make it and bring that care in that healthcare.
Thanks for sharing, Senu. I find this at least very relatable. I'm sure others do. And sometimes also it's not due to bad intention, I feel, but it's just process being so fragmented that eventually it converts into a bad experience and something which certainly all of us have to work towards solving. I want to come to you, Pranav. You come from Flipkart. I know in this current role, you are the Chief Product and Technology Officer for the healthcare business of Flipkart, but you came from a traditional e-commerce background. So coming from such a non-healthcare background, when you look at healthcare, how do you look at this transformation journey? What all are the short-term and long-term goals that you have in terms of transforming healthcare at Flipkart?
Sure, thanks. So I think I will answer this in three parts, right? First, I think we have to understand the context of the country, what's happening in next 5 years, 10 years, right? And then probably I will come to the Flipkart part of the journey, right? So the topic is very broad, by the way. We have a issue of, women hygiene to, global tourism and health tourism, right? And everywhere the business model can be very different. So it's a very, very broad stroke. Right, but let me share some insights and data. Right, in next 10 years, right, our middle class will be, today it is 1 in 4. In next 10 years, it will be 1 in 2. Right, and what does it mean? In general, consumption will increase, right, for the health, for the healthcare services and so on. So that is one. Second important piece is that, everywhere we read, right, we have a competitive advantage because we have a huge young population, but at the same time, we have a very decent mix of people who are aging, right, and they have a very different sets of health problems. So as a country, we are not a very healthy country, right, including the young population, and if this country has to grow, the productivity will come from very healthy young population, and that has a very unique problem statement, and all of you would have read the recent Lancet study, right? 100 million plus diabetic patient and 136 odd million are pre-diabetic, and if you look at very spectrums of the diseases, very big part of the country and the young population is covered with some kind of disease, right? And if we have to perform and grow, we have to be healthy. So that is, I think, another big important piece. The third is that, the whole infra part which she mentioned, right? That also has to massively scale up, right? And one, again, example is that, today close to 60% is out of pocket expense, right? Even though the insurance is covered, but I think it is not holistically covering, and I will have a viewpoint at some point in time. So these are some, very fundamental issues which are, coming at a macro level in the health, right? So problem with young, problem with old, scaling of infrastructure, increasing of consumption, and then as both the panelists mentioned that, it is getting organized, it is in the journey, right, of organization. Now, why Flipkart, right, what's the thesis? So number one is basically when we saw the, Government of India's digital mission, Ayushman Bharat mission, right, it gave a very comprehensive framework that, how technology can, intervene into each and every sector and impact at a very large scale. So that is, I think, one part. Second question to us is that, today, for last 15 years, Flipkart has been innovating for Bharat, right, whether it is metro, whether it is tier 2, whether it is a rural, right, through technology. So if we don't solve it, who else will do that, right? So that's a question at the face, right? So the inspiration from Ayushman Bharat, and then our experience of building technology for the whole country, right, led us to this. Now, what are we doing? So 3-4 very important areas in short and medium term, right? And I will start the sequence in the other way around, right? The first is that, we are more focused on creating the ecosystem, right? And let me give a couple of examples. One is that, we run something called a health buddy model, a very unique model. So generally Flipkart, we think only e-commerce. So this is a phygital model, right? So we have someone at every pin code in rural area who is a healthcare provider, health buddy, right? And he is using the technology. to become more productive, more efficient for the consumer, right? So while it gives the very personalized, very assisted healthcare, it is massively generating the job. It is improving, in general, the skill set of the country, right? So that is one example of ecosystem. I don't know how many of this room will be aware of. We run something called a grid. It's a engineering grad level competition, and this we have been doing for I think 4 or 5 years. This year we in the grid launch health as a topic, and there are 25,000 plus engineering students have opted to compete, right? And the topics are from quantum computing to health to diagnostics to various areas. Right, and the outcome, what we are expecting is threefold. One is, of course, new ideas, new innovation. But this new generation will enter into this space, right? A lot of startups will come from these guys, and they will go and proliferate in the ecosystem. So that is, I think, the one story about building the ecosystem. We are very actively working on with a lot of technological partnership with international players, that how to make doctors more effective, the whole ecosystem more effective. So that is the ecosystem part of the thing. Now, what other pieces we are doing is basically from the consumer perspective. As I said, we are a little bit starting the journey the other way around, tier 2 and rural area, and chronic disease, which is 60, 50 plus people, right? Where the kids are not there, they have migrated, the parents are living alone, they need the service at home, and that is what we are trying to crack first, right? That, how do you enable that, right? And given the Flipkart, we want to ensure that accessibility is there, so we are pan-India, that is what our goal is. We provide a high quality service. So that is the second important piece, and that is where technology plays a very, very important role, both in reach and ensuring that the quality is intact. And third one is, we also believe that, healthcare and fintech, so I'm not using the word insurance, because, insurance is only one type of solution. And this country needs a plethora of solution from the financial perspective. And thus, healthcare and fintech has to come together to solve this. So I think that is the second consumer piece which we are doing. The third piece, which we are quite interested in and bullish upon, is that, and two aspects of this problem. One is that, in India, we have not explored what we have, right? So how do we organize our Ayurveda, right? Today, Ayurveda ranges from, spa treatment to Ayurvedic doctor to all our friends and our own knowledge, right? From haldi to kadha to whatever, right? How do you structure it and build a solution around that for our country, right? And there are other, diagnosis and pathology around that. Right, or the traditional part. So that will be another very interesting area which we will be focusing on. And the last one is that, the awareness piece, right? I mean, when we went for the e-commerce journey, the biggest thing was that, hey, what is this online shopping? What will it do? How will it help us, right? So there is a huge learning and awareness curve. And today, if you see in healthcare, that is the biggest problem. Right, you don't go to doctor unless you are really, really sick, right? You try everything at home. If you are a chronic disease person, you don't, have a regular checkups, right? It may be because of convenience, or it is largely because of mentality. And our young population, I don't know the exact number, but I'm sure very few will be interested in preventive, right? So how do we solve for that awareness and the habit changing? So that is the third aspect. So the way we see it, build an ecosystem, leverage Ayushman Bharat's mission and the framework, leverage Flipkart's strength of technology, right? Built for Bharat, which is, the Ayurveda and so on. Solve for the fintech and the health using the ecosystem. Make it affordable. So that's the journey from short term to long term.
Thank you for sharing, Pranav. So as I look at all the comments that all of you made, right? One question, and in context of the National Digital Health Summit I have, because India is massive, right? We are such a large country. Very recently, I visited the Statue of Unity. I come from Gujarat, so at the Statue of Unity, it's majestic, it's inspiring. On a good weekend, every day 2 lakh people from all over the country come to visit the statue. So it's super crowded, and yet many people can't make it. So we're jokingly discussing that, right? Like probably India needs 12 such statues because we are so large. So I want to take that in context of what all you are doing, right? India is very massive. You can work very hard, build scalable solutions, and it's hard to solve for still Bharat as a whole. So how do you do that? Like, what are the different techniques? Do you sometimes say that we'll solve for this part, we'll hope that others replicate this in other parts of the country? You find right collaboration models. How do you solve for such a massive country?
So I think just adding the example, right? So opportunity, and then I will very quickly come to your point. Okay, we build, Aadhaar infrastructure, right, as a country. Right now, world is bringing, last couple of days, there is a whole buzz about, what Sam Altman is trying to do is very similar to Aadhaar with using a different technology, right? We build the whole UPI, now we are exporting that technology, right? We adopted mobile phone very quickly, right, compared to the rest of the world. I think in health, there is opportunity that we can do a lot of first in the world, right, through technology. Right, and if you look at, and I'm not judgmental about this, in a lot of Western countries for last 20 years, every election is fought on this healthcare, right, technology and all that, and they are struggling. I'm a firm believer that I think India will take a massive leap here, right, using technology. So that is, I think, the first belief part. Right, coming back to the solving for India, yes, India is very diverse, right, like the habit changes every 100 kilometer or maybe less than that, right, and you have to solve for each and every of this segment one by one, and that has to happen with very deep connect, right, and I will tell you one very interesting characteristics of maybe e-commerce and health, right? E-commerce still is a little, can be painted at a little larger spectrum. But if you look at health, health is a very local network, right? At the city, at the pin code level, you have a doctor, you have a pharmacist who is working with that doctor for that community, right? You have a diagnostic lab across that city, and they are not hooked up to the national level, right? So here we have to go very, very deep. Learn those local network, build those solutions for those local network, solve for problems in Mysore to problem in Rewari to problem in Lucknow to problem in Guwahati, and they might be very, very independent, and that is where the technology comes very, very handy, because technology can be very, very flexible, very adaptive, right? But very deep consumer research, that is one point, coming back to your point. Number two, very deep ecosystem building, because these players have to come up, right, to really build, right? Sitting in Delhi or Bangalore, in case of Flipkart, you can't build that. You have to go really to the ground level, and at the same time partner with all the ecosystem players, right, to solve that problem. So that's the way I believe.
Just to add to Pranav's point, I think he touched upon a very interesting point that India, the way we adopted phones, no one has done that. And we live on WhatsApp, live and breathe on WhatsApp, literally. So just to add on to that point, because you said, Purav, that it's a country of many countries, we'll have to think of sort of the pyramid, right? the upper class or people who have more affordability are struggling with chronic diseases, right? In India, a patient ends up with a heart attack at an average age of 50, while in the US, the average age is 69, right? So the problem to solve there at the top of the pyramid is actually putting the person on a systematic care pathway so that I can prevent or delay the next hospitalization, right? The problem in the middle of the pyramid is that they literally have no time, right? They're very aspirational, trying to move up. So they have no time for a preventive diagnostic test. They're smoking because of stress, because aspirations, don't have all the means. They drink very often, so they end up with fatty liver, right? Or they end up with undiagnosed cancer, which shows up very late, right? So these are the problem in middle of the pyramid, which we'll have to solve through better awareness, as Pranav was saying, also through better availability, right? For example, can I get a diagnostic test at a lower cost available at home to diagnose, or can I get certain healthcare management which is very, very easy and can be done quickly, personalized for me, right? And the lower pyramid, it's really about the financing. It's really about hygiene. As we've seen massive infectious disease endemics. We have seen women health hygiene issues. We have seen women still dying during birth, or infants dying in our lower of the pyramid section. So that is about financing and more initiatives through government, large enterprises, on ensuring that people have the money to get basics of healthcare and we can maintain the basic hygiene. So a little bit on that level we'll have to do. I think the government is doing a whole lot on middle of the pyramid. The lower pyramid. The middle and the top, is more aware and can be digitally connected through a WhatsApp onto a very systematic care journey. And when the ecosystem comes together, the focus shifts to outcomes for that part of the section, right? So healthcare outcome focus for that section will be very, very critical. Otherwise, we end up losing trillions of dollars in economic productivity because of poor outcomes due to chronic conditions not managed well. So, I've had friends who have had a heart attack at the age of late 30s very recently, right? So it's no longer a phenomena of 60s or 70s, right? Chronic diseases are happening in the 30s. So I would say a very systematic pyramid-based approach will be required to solve for India.
Makes sense, makes sense. Thank you, Khushboo. Thanks, Pranav, also for sharing. I know we are up against time, but since they're not watching, maybe we can take one or two questions from the audience before we close. Yes.
First of all, thank you for allowing me to speak. I'm Dr. Atul Arora, basically physician, actively associated with various medical associations and insurance sector also. I had been the CEO of one of the third-party administrator. You said about the chronic, my question is to Khushboo. You said about the chronic disease management and through your new age healthcare models, you are doing the chronic age disease management. I just want to know, because there is no case studies or no studies available on anywhere, how effective that had been, how much has been the decrease in the hospitalization after that over a period of time, during that period of time, and how it, since you have said you have been associated with various insurance companies also, how that has helped the person, because if the hospitalization, basically in India, the health insurance is indemnity. If the hospitalization has increased, does there is any impact in reduction of the premium afterwards?
Great, thank you so much, doctor, for your kind question. So I think very, very relevant. How we look at outcome is at two levels. One is for the patient and one is for the insurer, right? For the patient, what I mean is that if a patient is living with diabetes, what is the HbA1c reduction on a point basis? If the person had high triglycerides or LDL or total cholesterol, what is the reduction there? We could talk about hypertension, we could talk about obesity and weight reduction, or smoking cessation, right? So one, we have published outcomes on what is the improvement in health for the end patient. So we have seen a 1.5 point absolute reduction in HbA1c. We have seen an average of 5% cholesterol reduction within 3 months. We have seen a significant improvement in HDL, and there's no medicine for a good cholesterol. So that is for the patient. And unless you're improving outcomes for the patient, the model doesn't work in healthcare in a sustainable way, right? The patient has to improve their health. Now, when we talk about the impact of this healthcare improvement, there is direct correlation of a health score of a patient, which insurance companies usually keep, right? Basis these parameters which I mentioned, or diseases or symptoms. If there's an improvement in the health score, your parameters improve, your disease conditions are managed, your smoking reduces, there is a direct correlation with respect to reduced hospitalization rate, right? So we have returned a 30% ROI within 18 months of working with large insurers. We also do this work with large enterprises, companies which are paying 100 crores of premium for their employees, almost work like mini insurers. So we have returned a 30% ROI within 18 months of this work, and our objective is to get to a 2x ROI in terms of reduced hospitalization. Now, when I talk about reduced hospitalization, what we mean there is if you take a cohort of users who were not with an intervention like Zyla, vis-a-vis a cohort of users that were put on a Zyla-like intervention, which is 24/7, 6 to 12 months of continuous care, digitally driven, data-driven, personalized, holistic on your lifestyle, medical, etc. And you look at the claims which were avoidable or could be delayed, right? So you remove all the trauma-related claims, you remove all the pregnancy-related claims, you get claims because of heart attack, kidney stone, gallbladder stone, hysterectomy, all of the avoidable lifestyle disorder-related claims, you are able to see a 30% return on an ROI. So at an absolute level, our aim is to get to a 2% absolute reduction in the avoidable claim rate, right? So by that I mean, in a high-risk cohort for an insurer, the insurance, the claim rate could be a 10% in a high-risk cohort. That's what I work on. Can I get it down to an 8%? And that leads to a 30% ROI at a baseline. So if that answers, Doc.
Thank you. But these, which you have mentioned, these are all the parameters which are to be monitored. HbA1c, lipid profile, and other things. The basic thing is how much is the hospitalization cost. If that person would not have been intervened, how early the retinopathy or neuropathy or other things are complications of that disease, particularly you are talking about the diabetes. So what will be the complications happen, at how much time? And after your intervention, and how long you have been interventing, have you made any study on that? After how much has been the increase in the duration of onset in the complication?
Correct. So, sir, I would say it is, a process which takes years, right? So there are some short-term low-hanging fruits in a high-risk population that I'm analyzing. There's some short-term low-hanging fruits such as this person has diabetes and is reporting an ulcer in the foot, which is not healed for the last 3 months. I know if I don't intervene immediately and ensure the person gets treatment, it can get to gangrene or diabetic foot as we call it. Correct. Or for example, this patient is an active smoker and is reporting chest pain for the last 2 months, which has not been resolved, right? Or for example, we're talking about a person with COPD who is reporting severe breathlessness just with two flights of stairs, right? So these are low-hanging fruits, immediately intervenable, right? So I have to look at risk and I have to look at who's intervenable immediately. And then there's some long-term aspects such as if I am on an unhealthy diet or I'm smoking few cigarettes a day, or I'm not taking care of my high triglyceride level, that will lead to hospitalization over the next 5 years. So there are some short-term gains and some long-term. What we have seen is that we've been able to reduce hospitalization apple to apple, cohort versus cohort within 18 months, by a level which returns a 30% ROI. Of course, when I track it over 5 years, I will have a real picture.
I will just add 30-second to the question also you mentioned, and on the same problem. Right, how do you get the insight? So when we speak to consumer, right, and of course, we are not from the core healthcare sector, so maybe it's a very simple insight. The adherence to the treatment is a very, very big problem in this country, right? We are not a self-starter and self-disciplined country in general, right? It's a general remark. right? Unlike West, right? Yeah. So in some of these treatments, it's just that, someone is following up continuously, right? It improves the adherence. And that adherence itself gives certain kind of output. I think that's our insight.
That is more important. Adherence to taking medicine is more important, particularly in the chronic diseases.
All right, so I think given time, we'll wrap up. Thank you so much, Pranav, Khushboo, Senu, for your insights. Thank you all for being a wonderful audience. We'll see you at.
Thank you so much. I'll request you to take a picture together. Thank you once again, Mr. Saxena, Ms. Aggarwal, Mr. Sam, Dr. Gandhi, for that fabulous session.